Today, nuestro tema es orientación temprana para diabetes. It's a big topic. I'm probably not going to cover every detail that you would like or need for your work, your anticipatory guidance work with your diabetics and pre-diabetic patients. So if I'm missing something, please just use the comment area to send me some feedback and say, hey, Rory, how would you do this, that, or the other? Whether it's vocab, phrases, etc. I'm glad to help you, and I want to make sure that you're getting exactly what you need. Well, so this is a huge topic. I mean, look at all these articles I was researching and looking at, marking up, and I had a lot of fun with it. But to be honest, it is a lot of work. So I would like to know also your feedback if this is what you want, what you need as far as anticipatory guidance stuff. I'm glad to run a series for 5 or 6 weeks here that we can touch on different anticipatory guidance topics. But I would like your feedback on whether it's worth it or not for you. Muy bien, empezamos con some riesgos para diabetes. Talking with your patients about what are some risk factors. So factores de riesgo is the word for risk factors. Here we just have, usted tiene riesgo para diabetes. You have a risk for diabetes si tiene azúcar más alto que normal. So if you have blood sugar that's higher than normal or pre-diabetes, tiene sobrepeso, or si usted es obeso. Tiene sobrepeso o es obeso. Tiene 45 años o más. Tiene familiares con diabetes. If you have family members with diabetes. Tiene presión alta. You have high blood pressure. Ha tenido diabetes en el embarazo. If you have had diabetes during any pregnancy. Si ha dado luz a un bebé que pesa 9 o más libras. So if you've given birth to a baby that's been 9 pounds or heavier. Si tiene estilo de vida inactivo, if you've got an inactive lifestyle. Si tiene enfermedad de corazón, if you've got heart disease. Tiene depresión. Tiene síndrome del ovario poliquístico. Síndrome del ovario poliquístico, so polycystic ovaries. O si fuma. All right? Bien. Continuamos. Signos y síntomas de azúcar alto. So some signs and symptoms of high blood sugar to talk through with your patients. Fatiga, dolores de cabeza, headaches, visión borrosa, blurry vision, frecuencia para orinar, so frequent urination, sed excesiva o boca seca, or boca seca, dificultad para concentrar, difficulty concentrating, tener más hambre, to be hungrier, ¿verdad? Confusión, falta de aire, dolor de abdomen, see? So confusion, shortness of breath, belly pain, abdominal pain. Y una nota, es importante comunicar con su doctor. It's important to comunicar con su doctor, conmigo, you might say, con su proveedor, with your provider, con su proveedor. Si siente algunos de esos síntomas, if you feel any of these symptoms, regularly, o si nota un cambio, or if you notice a change. Moving on to signos y síntomas de azúcar bajo. Ritmo cardíaco irregular, so irregular heartbeat. Fatigue again. Pálor o piel pálida. Temblores, so shakiness. Ansiedad, anxiety. Sudores, so sweatiness. Piel húmeda. Húmeda would be any kind of word for moist, ¿verdad? So moist or wet skin. Hambre, hunger. Irritabilidad, irritability. Hormigueo en la boca, so tingling. Hormigueo en or alrededor de la boca. Llanto mientras duerme, crying out during your sleep. I didn't make this up. This is something I saw in one of the articles I was reading. Llanto mientras duerme, that was a new one for me. Confusión. Visión alterada, so altered vision, por ejemplo, visión borrosa. Convulsiones, seizures. Pérdida de conocimiento, okay, getting more severe now, right? Pérdida de conocimiento, so loss of consciousness. Azúcar bajo puede tener consecuencias severas. You could change severas to graves if you want to. Es importante tomar un jugo or un refresco normal. So it's important to drink a juice or un refresco normal, a normal soda, like not diet. O comer algo dulce, or to eat something sweet. All right? Bien. You probably want to add more. I just wanted to keep it simple for you, ¿verdad? Okay, so cuando hablas diabetes, normally you're talking dieta también. So let's look at dieta un poquito. Hablando dieta. Una dieta balanceada puede prevenir la diabetes y ayudar a controlar el azúcar. So a balanced diet can prevent diabetes and help control blood sugar. En general, es importante, so in general, es importante tomar más agua, comer porciones pequeñas, comer comidas altas en fibra, high in fiber. We'll look at some examples here soon. Comer grasas buenas, eat good fats. Comer comidas con un índice glucémico bajo, so eating low glycemic index foods. Let's look at some examples because just talking about categories like this isn't maybe necessarily that helpful. Ejemplos de buena dieta. Examples of a good diet. ¿Sí? Comidas altas en fibra, so some high fiber foods. Vegetales, vegetables. Almendras, almonds. Avena, oatmeal. Garbanzos, chickpeas or garbanzos, yeah? Lentejas, lentils. Manzanas, apples. And now some grasas buenas. Now there's probably others also, right? The list is large and I didn't want to go too crazy, but if you think there are some others that are super importantes or common, put them down in the chat area and I'll help you figure that out in español. Grasas buenas. Aguacate, avocado, ¿verdad? Aceite de oliva o canola, so olive oil or canola oil, ¿sí? Comidas con un índice glucémico bajo no elevan el azúcar tanto. Okay, so low glycemic index foods don't elevate your blood sugar tanto here, just meaning so much, right? So let's look at some examples and instead of type examples as well. So por ejemplo, arroz integral, so whole grain rice en vez de arroz blanco. So arroz integral, you could use that for brown rice or any whole grain rice, right? En vez de, instead of arroz blanco, instead of white rice. Pan integral en vez de pan blanco. So whole grain breads instead of white bread, ¿verdad? Tortillas y pastas de trigo integral. So tortillas and pastas from whole wheat, ¿verdad? Avena en vez de otros cereales. So oatmeal instead of other cereals, ¿verdad? Especially those cereales azucarados. Frutas y verduras crudas. So fruits and vegetables crudas, raw, uncooked, ¿verdad? Frijoles, ejotes y lentejas. So frijoles, beans, what you would think of as normal beans like pinto beans, black beans, etc. Ejotes would be more like a green bean. There's many words for this stuff. Vainicas, judías verdes. One of the problems with foods in Spanish is that since regions are so diverse throughout the Spanish-speaking world, there's all sorts of synonyms and one word here, one word there. It's impossible to include everything. So ejotes, lentejas, lentils. Bien? And then when you talk dieta, you also tend to talk about comidas that you want to avoid or limit, ¿verdad? So comidas para limitar y o evitar. Okay? Grasas saturadas, mantequilla, butter. Carne de res, beef. salchichas y chorizos. So salchichas, hot dogs, y chorizos, sausages, ¿verdad? Tocino, bacon. Lo siento, es uno de mis favoritos. Grasas trans, ¿sí? Grasas trans. So, por ejemplo, meriendas procesadas. So, these processed snacks, ¿verdad? Mantecas, any kind of lard or animal fats. Comidas rápidas, fast foods. Pan dulce, because it includes a lot of these mantecas y todo. Colesterol. Carnes grasosas, so fatty meats. Yemas de huevos, so egg yolks, ¿verdad? Hígado, liver, y otras carnes de órganos. So liver and other organ meats, ¿verdad? Son altos en colesterol. Y también hablamos sodio un poquito, Sodio, usar menos sal en la preparación de comida, so using less salt in food prep. Y no echarle sal en la mesa. So don't add salt to your foods at the table, ¿verdad? Okay, bien. Dieta, and then the other part of the equation is oftentimes ejercicio, ¿verdad? So hablando de ejercicio un poquito, actividad física is maybe a better term than exercise. I know that a lot of times in our work in Central America with underserved communities, if you talk about physical activity versus exercise, it tends to connect better with people because possibly just the vocabulary word exercise could bring to mind, gymnasium or some kind of activity that requires resources in order to do, ¿verdad? But actividad física could be other things. Entonces, actividad física regular es importante para mantener buenos niveles de azúcar. So it's important for maintaining good levels of azúcar. Ayuda a su cuerpo usar el azúcar en la sangre. It helps your body use the sugar in your blood, ¿verdad? Su meta, your goal, es 30 minutos de actividad 5 días por semana. So 30 minutos de actividad 5 días por semana. Toda actividad física le ayuda. So all physical activity helps you, ¿verdad? Es importante hacer algo que le guste. It's important to do something that you like, ¿verdad? Por ejemplo, caminar rápido, walking fast. Correr, run. Andar en bicicleta, so riding a bike. Levantar pesas, weightlifting. Bailar, dance. Jugar fútbol, playing soccer. Nadar, swimming. Okay? Bien. So, hablando de actividad física, emphasizing el punto, something you enjoy doing. 30 minutos de actividad 5 días por semana. Okay, when we talk about controlling blood sugar and tests and things like that, A1C typically comes up. So, A1C, ¿qué es? ¿Y cuál es la meta? Bien. La prueba A1C es un análisis de sangre. Mide la glucosa en la hemoglobina. So it measures the glucose on the hemoglobina. Okay, if you were to describe what hemoglobina was, es una proteína en la sangre. See, I think that's right. It's a protein, yeah? Okay, es una proteína. Nos dice el promedio de sus niveles de azúcar por 2 o 3 meses. So it tells us the average, el promedio, de su nivel de azúcar por 2 o 3 meses. So it gives us the average reading of your blood sugar for the last 2 to 3 months. Usamos la prueba para identificar prediabetes, identify prediabetes, diagnosticar diabetes, diagnose diabetes, evaluar su control de diabetes. So, and evaluating your control de diabetes, how well you're managing your diabetes. Bien. Un A1C menos de 5.7% es normal. So an A1C less than 5.7% es normal. Un A1C entre 5.7% y 6.4%, so between 5.7 and 6.4%, es prediabetes, is pre-diabetes. Un A1C mayor de 6.5% es diabetes, right? And you could talk about how many different measurements you need to make the diagnosis. Necesitamos un A1C mayor de 6.5 dos veces o tres veces para diagnosticarle con diabetes. Okay? Es importante mantener el A1C entre 6.5 y 8%. During some of my research, I saw that in 2018, apparently some studies were changing that goal A1Cs are between 7 and 8% now, based on the risk-reward calculation and some studies that were recently done. No sé si es verdad en su clínica, en su práctica, but that's what I saw in mi investigación. Okay, so we always talk about pies diabéticos también, right? So talking about diabetic feet and foot care and things like that. And thank you, John, for the comment to make sure I got this included. Hopefully this is what you're looking for. Pies diabéticos y zapatos. Con diabetes hay menos flujo sanguíneo en los pies. So there's less blood flow in your feet con diabetes. También puede perder sensación en los pies. So you can also lose sensation or lose feeling en los pies, neuropatía. Puede resultar en heridas en los pies que no se sanan. So this can result in injuries or wounds in your feet that don't heal on their own, que no se sanan. So, es importante siempre usar zapatos con calcetines limpios y secos. Always use shoes with clean and dry socks. Revisar los pies todos los días para cortadas. So, check your feet every day for cortadas, cuts, lesiones, any kind of injury or wound, ampollas, blisters, hinchazón, swelling, problemas con las uñas. So any problems with your toenails, ¿verdad? Limpie los pies en agua tibia. Wash your feet in warm water. No use agua caliente. Don't use hot water. No olvide secar entre los dedos de pie. Don't forget to dry between your toes, ¿verdad? Use cremas en los pies, pero no entre los dedos de pie. Use cremas, but no entre, not between los dedos del pie. Tenga cuidado cuando corta las uñas. Be careful when you cut your toenails, ¿verdad? Okay. Complicaciones. Es importante controlar el azúcar porque hay complicaciones severas. So, complicaciones de no controlar el azúcar. Es muy importante tomar en serio, to take seriously, tomar en serio su control de diabetes. You might be noticing, and it would be good to notice, that when we talk about management of any illness, it's usually that translation for management is best translated control. So, su control de diabetes. Diabetes puede afectar, diabetes can affect, el corazón y los vasos sanguíneos. So your heart and your blood vessels can cause ataque de corazón o derrame cerebral. So heart attack, stroke. Amputación en los dedos de pie o los pies. So having to amputate your toes or your feet, ¿verdad? Los ojos puede causar glaucoma, cataratas, cataracts, pérdida de visión, so vision loss. Los riñones, your kidneys, puede causar insuficiencia renal, so kidney failure. Whenever we talk failure in Spanish, insuficiencia is your word. So insuficiencia cardíaca, insuficiencia renal, insuficiencia hepática, I can't remember what's that. Maybe hepática? Okay, bien. No, hepática, I think, aquí. Los nervios puede causar pérdida de sensación en los pies, loss of feeling or sensation in your feet, las manos, your hands, y otras partes. Los dientes y las encías puede causar enfermedad periodontal, inflamación y sangrado en las encías. So inflammation and bleeding in your gums. Okay, so hablando tratamientos, as you talk about tratamientos and setting expectations for treatments, you might want to consider un poco de esta información. Necesitamos llevar buen control de su azúcar. We need to manage your azúcar really well. Okay? Empezamos despacio con sus medicamentos y ajustamos como sea necesario. So we'll start slow with your medications and we'll adjust as needed. Okay? La diabetes es una condición progresiva. It's a progressive condition, ¿verdad? O progresa. It progresses over time. Con tiempo, los tratamientos van a cambiar. So with time, our treatments will change or aumentar or increase. You could think of maybe some other verbs that you would want to be able to say is going to happen to the treatments over time, ¿verdad? También es importante llevar buen control de. It's also really important to manage really well la presión, so blood pressure, la función renal, so your kidney function, el colesterol, your cholesterol levels. And so maybe you could talk about, es importante llevar buen control de presión, función renal, el colesterol. Vamos a hacer unos análisis o unas pruebas de la función renal, ¿ok? Es importante para usted tomar en serio. It's really important for you to take seriously la dieta, su actividad física y el autocuidado de los pies, etc. And self-care, autocuidado de los pies, and any other self-care topic you'd want to discuss with your pacientes. Okay, that's a lot of información, and we went kind of fast. So your tarea, su tarea, esta semana is to review the notes, highlight the vocabulary that you want to be able to start using right away, and commit that stuff to memory. And as you're memorizing that vocabulary, remember, you're always going from English to Spanish, and then you flip it around and you go from Spanish to English so that you've got a good control or command of that vocabulario. Identify other vocabulario and phrasing that you need or want, okay? And when you identify that, if you can't find it, if you're uncertain, hey, use the comment feature here and I'd be glad to help you sort some things out, give you my suggestion on how you might say something. And there's plenty of other people in the community as well who'd love to participate in your improving your Espanol. So keep it simple. You'll notice that in this whole lesson today, we didn't get very complicated with our grammar at all. So there's some really basic phrases I'd like you to make sure that you make a note of. For example, I used a lot of es importante and then just an infinitive verb. So es importante llevar buen control de su diabetes. Es importante comer una dieta balanceada. So what's nice about this es importante, very simple phrase, and your next verbo is that you don't have to conjugate any verbs, okay? Usted necesita. Similarly, you don't have to conjugate any verbs. Usted necesita with your next verbo. Usted necesita lavar or limpiar los pies todos los días. Usted necesita tomar su medicamento todos los días. Okay? Yo voy a, or nosotros vamos a, usted va a, with your verbo infinitivo. So this is a great way to use just present tense, voy, vamos, va, and refer to the future. Okay, you don't have to learn a separate future tense, and in fact, most Spanish speakers don't use the true future tense. They'll just use this. It's a compound tense using the verb ir. It's the going to. I'm going to, you're going to, etc. Okay? Bien. And then, of course, give it a try. Practicar, give it a try with your patients, and like always, you want to have language help close by, right? Whether that's on the phone or with a coworker or the interpreter for your clinic or your practice. Bien. Well, muchas gracias por aprender español conmigo. Juntos mejoramos comunidades realmente. And so, más en español, Common Ground International. If you want to work on some español específico médico, head over to certifiedspanish.com, and we've got some free language testing for you there. Okay, muy bien. Hasta pronto. Ciao. Thank you for joining me today on this Video Viernes lesson. I wanted to invite you to join our community if you're not a member of the Facebook group already, that I deliver these live lessons in on most every Friday. And also point you to the website where you can find a bunch more information about medical Spanish, whether that be courses or free materials for you, or finding a private tutor to work with you online or face-to-face. And also let you know about some amazing Spanish immersion programs, either you as a medical person or your significant other as working in some other industry, or your family. If you want to improve your Spanish and you have time and budget to go do some travel, our programs are pretty amazing. I think it'd be fun to work with you. And finally, if you have some document work at your clinic or at your hospital or within your setting that needs to be professionally translated, shoot me a message, upload your document to us, and we can get you a quick quote and help you out with your Spanish language documents as well. Have a great day.